Elisabete Coutinho. I'm a mental health and well-being practitioner in the Newbury Community Mental Health Team.
Hi, my name is Chloe Harley-Shoveller, and I am a mental health and wellbeing practitioner, and I currently work in the perinatal team. So, who are mental health and wellbeing practitioners? Well, the mental health and wellbeing practitioner role, or MHWP for short, is a relatively new role. It's now in its third year, and already in Berkshire there are MHWPs within a variety of teams across the trust. As the name suggests, the role sits within the psychological professions sector of the trust, and we work with adults, focusing on their goals to support their recovery from poor mental health. And in order to become an MHWP, you need to undergo a year-long course, which Elisabete will talk about in a bit more detail later. Next slide, please. Thank you. So the role of the MHWP can be broken down into two parts. So first, delivering short-term interventions that are well-being focused and therefore low in intensity. All the interventions are guided self-help and are based on recent NICE guidelines. Second, collaboratively care planning with the service user, their family or carers, members of the MDT and other appropriate services. So as discussed, MHWPs offer a range of psychologically informed interventions. Most service users will have one or maybe more mental health diagnoses, but the intervention that we deliver might not be the one that seems most obvious based on the diagnosis, as through a problem-focused assessment, we establish what the service user's current main concern is and what they want to work on. The interventions are CBT based, but don't replace NICE recommended psychological therapies. Please. Thank you. So there are 8 interventions that we can offer, and I'll just give a brief summary of what they are and how they're used. So the first one, behavioural activation. So this focuses on the role of behaviours and is an effective treatment for depression. So first we do some psychoeducation on low mood maintenance, and then help patients re-establish their daily routines, increase pleasurable activities, and address important tasks, which reduces the time able to dwell on negative thoughts, which also improves physical symptoms. Next, we've got graded exposure. This looks at the role of avoidance in a person's life, which is preventing them from being able to complete certain activities. And we encourage habituation by by staying in the feared situation, it becomes less of a threat. And we'd create an anxiety ladder, which we then use to achieve goals in order of difficulty. And exposure needs to be prolonged, repeated, and without distraction to be effective. Then problem-solving skills. This is good for people who feel overwhelmed with life's problems and don't really know where to start, as it enables a person to take a step back from the problem and consider what solutions exist. We tackle the practical aspects of the problem by identifying the strengths and weaknesses of all solutions and then assist with the implementation of it. So to start with encouraging good sleep, we'd provide information as we do with all interventions. So we'd be educating the patient about sleep cycles, sleep pressure, common sleep problems, and then the factors that disrupt sleep. So to help someone who's having a sleep difficulty, we would first assess their sleep, then identify the factors that are disrupting their sleep, set a sleep window, build sleep pressure, and then help with sleep hygiene. Recognizing and managing emotion starts with psychoeducation on the role and importance of emotions. Then we would identify the problem emotion or emotions, work out the action urge, which is the behavioral response when we feel that emotion. We'd see if the emotional intensity is too low or too high, and then we'd work to either increase or decrease the intensity depending on the previous answer. With the guided self-help for bulimia and binge eating, this one isn't as common within the trust, as we do have a specialist eating disorder service. But where this is taught, the first thing that would happen is we'd create an understanding of the triggers and elements of this vicious cycle, and then provide psychoeducation on the risks of it. Then we do weekly weigh-ins alongside a pros and cons list for change. Fear foods would be ranked, eating patterns would be reviewed, and any emotional triggers and body avoidance or checking would be identified. With building confidence, we'd first start with the education on the cycle of low self-confidence and how self-confidence can be built. We'd then identify values and strengths that are individual to the service user, and then plan to do tasks or activities that would display or enhance those qualities during the week. And then reflecting on what has gone well is also an important step. Finally, medication support. So we can offer basic information to support in managing issues around medication. As MHWPs, we can't make decisions about prescribing, but we can monitor the service user's adherence to medication and provide some general information about different types of medication and help with some common misconceptions. So what does the day in the life of an MHWP look like? So it might vary slightly between teams, but the general gist is the same. So each week you'll be doing problem-focused assessments to identify the area of need and set goals. Then you'll be delivering the treatment sessions themselves, which are up to 1 hour in length. You also might be running groups and signposting people whose needs would be better suited elsewhere. Every week you'd also have case management supervision, and there's also a set amount of clinical skills supervision hours that you're required to have. Attending MDTs and referrals meetings also form part of our role alongside liaising with other professionals.
The entry requirements to become a mental health well-being practitioner. You can train for a postgraduate or graduate certificate depending on whatever you already have a degree qualification. For the postgraduate route, you will need a bachelor degree at 2.2 or above in any subject. For the graduate route, you will need to evidence your ability to study successful at the academic level 3. If you'd like more information regarding the Level 3 awards, please look at the link provided on this slide. You also need to demonstrate some experience in employed or a formal volunteer role, helping people with psychological, interpersonal, or social problems. Must-have skills of a mental health well-being practitioner trainee are interpersonal skills and ability to build trusting relationships with a range of people, the ability to work well within a multidisciplinary team, a good understanding of mental health issues, strong written and verbal communication skills are a must, ability to work independently and think quickly in often challenging situations, being creative to solve problems, and manage time effectively. What happened during the training year? 1 year training program is developed by the Oxford Health or other course provider exists across the country. We need to attend 1-2 days at university per week, depending as well the course provider, and the rest of the days in service. Trainees will be accessed through a variety of methods. These include some essays, clinical case reports, exams. We need to provide an audio record with a patient to demonstrate our clinical skills, and the supervisor needs to sign all our competence by the end. All the assessments needs to be passed and contribute to the award of the certificate. During this training year, you need to have regular meetings with your supervisor to support you in your work, to help you engage in self-reflection, to seek and respond to feedback, provide the patients, or the tutors and develop your professional skills. Where a career as a mental health well-being practitioner can take us. Once qualified, your employer will provide you with ongoing training to keep your skills and knowledge up to date. To support your practice and your well-being as a practitioner, you will be provided with regular supervision. This will be clinical and caseloads. Mental health well-being practitioner is a new role, so progression opportunities are still being developed. A 2-year psychological profession fund rule was implemented in April 22. This means that if we start the NHS funding psychological profession training from April 2022, we won't be eligible for another funding for a further 2 years. So we need to work on a role for 2 years in order to apply for funding when that means changing your role. My journey to become a mental health well-being practitioner. I graduated in 2017 with a BA degree in sociology. I completed a master's degree in health inequalities in 2020. I then applied for a mental health support worker role in 2020. I worked 2 years in this role and then I applied for a trainee position, which I started in October 2022. I completed the training in January 2023, and currently I'm still a mental health well-being practitioner at the community mental health team. If you are interested about healthcare careers or psychological professional at work, you can access more information and guidance on the links provided on a slide. Thank you very much for listening. I hope you have a good journey. Bye-bye.
Thank you. Bye.